with trauma, it's not what did happen to you, it's what could have happened. My name is Warwick Phipps, and in this episode of our podcast, Marizaan, Koen and myself are talking about anxiety. What is it? Why is it so prevalent in modern day life? What does it look like? And how, as therapists and individuals, we can minimize the impact it holds over us. Share this with someone.
We have Dr. Warwick Phipps with us today, and he's from Therapy Work Centre. He's a clinical psychologist. So I just want to say welcome, and I'm so glad to be talking to you today here.
Thank you, Marizaan. Yeah, I too have been looking forward to talking with you. I know that we've worked together for a very long time, and know that you're a very meaningful psychotherapist, clinical psychologist. So I'm looking forward to our discussion today.
Okay, yes. Well. So today I just want to talk a bit about anxiety. So just understanding anxiety a bit, and just where we are in our environment with anxiety, and what causes a lot of the anxiety, and just having a look at how to deal with it. What is the prevalence of it, and just that we can discuss a bit more about anxiety and to make a bit more sense of it.
That's a broad question, but you're also noting something, and that's really around anxiety. And just that you've identified it is, as I see it, something so important that effectively we're seeing such an increase in an anxiety within the community, within our society.
Okay.
And there's always some degree of distress or anxiety, but there's been, certainly in my experience, a huge increase.
Okay.
I'm not sure in terms of the way you practice, and we, of course, we work together, but in terms of those who come and see you and are seeking help, I don't know if you see the same thing.
Yeah, no, I really go with that. It seems like there's people experiencing more and more anxiety, and that I think with family and friends as well, is that people seem to be more anxious in general. Well, what is your take on it? Do you also experience that?
Yeah, very much. I would say that ever since COVID, there has been an enormous increase in those experiencing anxiety, both anxiety and depression. The two seem to have gone up considerably. And following COVID, many people, many individuals, couples, families are experiencing very high distress, both with an increased rate of depression and anxiety.
Why after COVID? So why did this increase so much after COVID?
Again, this is such a key question, and there's different parts to it. I think one of the aspects of COVID is it was so unexpected, and it was terrifying. And for a society and everyone, there were just daily messages of threat, harm, danger. It was a terrifying time. And there was also enormous loss. There was a great loss during this time, losing family members, losing friends, or being very much afraid of losing someone very close. So there's enormous loss and threat during this time, a very, very scary time and very terrifying, with great loss. And so just being faced with that creates enormous anxiety, both for someone that you love or for yourself, and being afraid of what could happen with the pandemic, the virus, whether you'd get ill, what would happen. And then the other part of it was someone that you know well, and or someone that you care about. Were they ill? What was happening? How to help them? How to protect them? So enormous anxiety on account of that. In one way, we could think of it that we're in a so-called post-COVID society where many people consider that things just go on as usual. But is enormous trauma that's being carried on account of COVID and loss. And that's certainly, as I experience it and see it, a huge contributing factor in the high anxiety and prevalence of anxiety.
Okay.
Yeah, again, I don't know what your thoughts are. What do you see in your practice and those come who's seeking help and support?
Yeah, I really go with that. I think there's been enormous trauma and enormous loss that we as a society experienced, and also the fear of loss. That's with a lot of uncertainty that was during that time as well. And I just to add to that is I think with the lockdown, that was another element that's just created so much stress for our community as well. Yeah.
Sure, I think there's a lot there that you noted. There are two things in particular. One, you said that the fear of loss, and we know that with trauma, it's not what did happen to you, it's what could have happened. And so many people, just the anticipation of possible loss, go through all those terrifying thoughts. How will I be? How am I going to cope? What's going to happen? And that is just the thought of it. So enormous trauma, even just in anticipation of possible loss.
Okay.
And then the other important aspect here that you noted was the social distancing. Really, that's a euphemism. We know that because what society and what we were all asked to do during that time was actually socially isolate ourselves. And as people, as human beings, we can learn rapidly. And so we actually learned to isolate ourselves and isolate ourselves very effectively. And in the short term, yes, that was helping supposedly with transmission and creating safety, although also we're learning a lot now that perhaps the degree to which we responded with isolation and some of the messages one would have to review. But it was to a large extent, the key aspect here was we learned to socially isolate ourselves.
Okay.
And we know that with isolation, that there's a very high correlation between isolation and anxiety. Where we have isolation, we have anxiety. And if someone shares with us that they're anxious, almost inevitably we can predict that they're going to be pockets of isolation, significant isolation they're experiencing.
Okay.
So, the second part of what I think has contributed enormously to the anxiety that we're seeing today, and also depression, relates to very high isolation on account of what happened in COVID and learning to isolate or having to isolate.
Okay. So the COVID pandemic actually had such a massive impact on us as a society, and actually still continues to do.
Yeah, it's had an enormous impact. And to a large extent, we, as I said earlier, we kind of think of and that everything is normalized, but it's not.
It's not.
We're actually carrying, and many of us, many couples, families, actually managing and bringing with a lot of trauma and loss, and then have remained very isolated. For instance, I don't know how it was in your family, if you noticed that you had to make a choice. Who would you be spending time with? Who would you protect? And so families then very often formed subgroups, spending time with one another, but not able to connect with other members or other groups in the family. And that was also the case for friends, having to be very, very careful about who you would see. And the impact of that we know that when you, again, isolate and you form subgroups, it can be needed, but we still sit with much of that today, that we haven't got to see some of those family members or friends, or we couldn't talk about the impact Yeah, I don't know if there was anything in your own family that you could see or relate to around this.
Yes, definitely. I think especially when we weren't allowed to cross the provincial borders. So that had a massive impact, where we were able to see some of the family members in Gauteng, but the family members that were a bit further out, we were not able to see.
Yes.
And it was months. It was
Yes.
such a long time.
Yes.
Yes, so definitely actually spending more time with some family members than being able to spend with other family members.
Yeah, so actually being cut off from family and seeing members of family that you would ordinarily see.
Yes.
Yeah. And then having to spend time with either by location or necessity, spending time with some family. But again, what does that mean for how we relate and who we are as a family and how we connect?
Yes,
Yeah, certainly. Again, that was very much the case in my family, because we've got family throughout the country in different provinces. And what we try to do during that time was set up virtual or online get-togethers. And that was one way of trying to bridge the distance. But in the end, it's not the same as, one-on-one and being together and sharing. And it just wasn't. It was a way of trying to cope.
Yes, it's more trying to connect and trying to see each other, but it's not the same as face-to-face.
Yeah, very much. Yeah. So if I just look at it, the main thing that we, again, are looking at is a society that's carrying a lot of trauma, a lot of loss, that's gone unexpressed and not worked through. And we know that that's to be expected, because when you go through trauma and loss, the first thing that you try to do is kind of push it away, push it down, and try to normalize it as if one just gets on and everything's normal. And that is an effective way initially of coping with crisis. But at some point, we need to start processing those emotions, those experiences. And then, very much that we remain isolated and haven't always been able to correct that, or we haven't even noted or seen it. And so many people now are not only carrying trauma that they're unaware of, but they're also very isolated. And they haven't registered and been aware of the isolation that they're experiencing and how COVID has changed their way of life, their norms, their way of connecting, getting out, being in the environment, seeing others.
Yeah, and then just want to check with you. So, with my experience, is that there seems like there's also a lot more conflict, especially in marital relationships after COVID.
Yes.
What is your experience with that?
Yeah, very much. There's been an enormous increase in couples seeking help for conflict, being distressed, being stuck. And it's an amazing thing that happened in COVID, in that when families, but let's just look at couples, had to isolate, it was a double-edged sword in a way, because it meant that couples got to spend more time with one another. And those couples where, for instance, they needed and wanted to spend time, but everyday life was just getting in the way, just being so busy, and where we know we often put our relationship, the things that we value, and even taking care of ourselves, that often goes last. And just getting on with all the other demands. And so for those couples, that was very meaningful, being able to slow everything down, centering, having time to see one another, having time to check in with one another, and creating shared experiences. That was very meaningful. For other couples, the being in a closed space, sharing the same space all the time, and the lack of new input, unless they were able to find new things to do, new things to talk about, very often trying to deal with messages around anxiety, fear. The couples became saturated with that, and often then experienced an increase in conflict, having to try and negotiate, work things out. And it would seem that whatever one went into COVID with, and whatever, say, a couple went into, COVID seemed to magnify the effect, seemed to magnify that. I don't know what your own experience was there, or what you've observed.
Yes, so so that's I go with that. It's I think there's a lot of couples that it's, like you say, it's a double-edged sword. That a lot of couples really enjoy the lockdown to some degree on some aspects, and being able to spend time together and work from home and just being with each other. But I also think it created a lot of distress for a lot of couples, where it is always together, having difficulties in managing the stress, managing the fear, and managing conflict as well. So I think there was with the lockdown, there was some positives, but also a lot of difficulties that actually came with it, and that couples actually deal with it still to today, where they're working through the conflict.
Yes, I would say that couples where they function very independently of one another, that could be and had become very stressful, and was, and especially if their situation hasn't changed. Many people we know are working from home and only returning to work in a very limited fashion, but by and large working from home. And so they are therefore assuming a shared space where they've used to being very independent of one another and have to coordinate there. And that could be very stressful. And we also know that just sharing a shared space, you're not in the same frame of reference. So unless that couple is used to checking in, learning to create context for one another, and bringing one another along at the end of the day with what the experience has been, and really finding time to check in, actually sharing a space like that geographically, but not connecting emotionally or checking in, actually has the effect of living past one another. And yet the couple have the sense of we've been together, but we're not connecting. So that would really and has a lot of effect for couples where they function very independently, and where they haven't learned to make time and learn how to connect with each other, and engage in an emotionally close way. Also, the other thing that I would add is that because of the threat during the pandemic, it evokes such fear. And so we know with fear that it's so primal that we want to protect, we want to make safe. And how couples would do that, they weren't always on the same page, because it was very much fear-driven. And some of the things that we were doing weren't always well thought through or irrational, which is part of all fear. It's normal. But again, one has to be able to talk that through and look at it. And couples and just finding they are very often just making safe, and are able to hear one another and work things through.
It's a lot of difficulties that actually stem from the lockdown and from the COVID pandemic.
Very much. I think it's actually going to be years. It's years, and we probably are going to look back really in 10 years, a decade, and recognize only then the degree of trauma, loss, and the degree in which our normal ways of interacting, connecting, were restructured around isolation, and what impact that's had on us, our society, our families, relationships, our children.
Massive impact in all spheres of life.
Yes.
Okay. So if we just have a look at specifically at anxiety, what are some of the symptoms that to look out for, to know that there is anxiety?
Anxiety really is so personal and subjectively experienced. And so it can change from person to person, but by and large, anxiety is a fear response. And it's one of the primary emotions. And so we all do in some way when we're activated by fear. experience some things that are very typical or common. There's the physical reactions. It's our heart beating faster. We may be perspiring more. We notice that we become more vigilant, looking around for danger. We're often noting that our thoughts go very quickly. Sometimes we become preoccupied with thoughts. And so there's a number of experiences that we have that effectively we're unable to be present.
Okay.
And we experience a lot of physical discomfort. And that's what one can begin to see. Someone will actually, if they experience that anxiety, it'll be so physical, like a tightness in the chest, breathing very, very rapidly, perspiring, heart racing. And they would actually get a sore chest, and to the point that they would begin to think that they're having a heart attack. Yeah, only to go to casualty and then learn that it was an anxiety attack. But at the time, it was absolutely terrifying because they actually thought they were having a heart attack. So, yeah, the physical symptoms are very, very impacting.
Yes.
Yeah. So there are physical symptoms that one can observe or experience. The other thing is that we tend not to, it affects the way we concentrate. We find that our attention is fluctuating the whole time. Very difficult to stay focused on anything that we're busy with. We often tend to want to sort of move around, trying to deal with that physical discomfort.
Okay.
And then we see actually longer term effects with that anxiety. Things like it's difficult to sleep, either falling asleep or staying asleep. We tend to wake up thinking about things, ruminating. If we've been able to study or work effectively, suddenly we find we just aren't working or studying as effectively. So it affects our productivity. And very often it's that ruminating. We start to think, and those thoughts tend to start going round and round. So there seem to be a whole lot of things that happen as soon as we become anxious, fearful.
It seems like there's a difference between anxiety and stress. What you described with anxiety and the symptoms, it's really immobilizing, actually.
Yeah, very. We know that anxiety and stress are both the same and different.
Yes.
So anxiety is really another name. It's another way in which we express what is the primary emotion, fear. So it's really on that continuum. And just to explain that, we know that all feelings are good as long as they're based on reality. And because feelings are there to guide us, they're our compass. And as soon as we can understand what an emotion is, what a feeling is, then we're able to deal with it. So fear is a primary emotion, and we all experience it. And it's not something we need to learn or have to figure out or how to experience it, or it's just there.
It just happens.
Exactly. We're human and we're people, and this is part of our adaptation. And it occurs any time when it comes to fear, it's the perception of threat. And as soon as we perceive threat, we experience fear. Our next thing is, though, whatever we perceive is not always accurate, so we need to do our reality test on 1 to 10, 1 being that really there is, once we start to look at it, interrogate it, and review it, either on our own or with another, that's not significant. There is no significant threat. And then that feeling of anxiety, fear just dissipates. Okay. If it is significant as 7, 8, 9, 10, then that perception of threat is valid, and that feeling is guiding us to then get out of the way of the threat, step aside, and to get out of harm's way. And we know that there are 3 ways in which it happens. It's either fight, flight, or freeze. Those are our 3 responses to deal with any kind of threat. So the main thing here is, as soon as we're able to start understanding what fear is and understand it as perception of threat, then we can begin to deal with it. But effectively then, that's why I say if there's that perception of threat, one has to look at it and then review it, interrogate it, and see how to respond. And that's really on that fear,
Okay.
the dimension of fear. And it goes by various names, but one of which is anxiety.
Anxiety.
Now, you're asking the question difference between anxiety and stress. It's all the same because we've only got a limited primary emotions. So it's all on the fear dimension. But usually when it comes to something like the distinction between fear or anxiety and stress, anxiety is at a point where that fear has become overwhelming.
Okay.
We're immobilized, and we can't function effectively. So it's just constantly there. We're constantly anxious. We're constantly fearful, and that can be very, very paralyzing. Stress, it's still on the fear dimension, but a little bit of fear can be helpful. If we've got an exam or a test, we've got to learn something.
Kickstarts
or
us.
Kickstarts. It mobilizes us to take action and to deal with a situation. So the main difference there is that stress is where it's really functional. It doesn't immobilize us. And we experience it we've got lots of demands, and it helps us to prioritize what's really important, what's less important, how to reach out for help, how to delegate, how to say no where indicated or appropriate, how to ask for help. So that's really all on the stress dimension, and we all experience stress. It's normal, it's functional, and there are ways that we need to deal with that stress, but effectively it's normal, and it's how do we manage it. When it comes to anxiety, then what we're looking at is that someone is very often feeling and experiencing a lot of fear. Okay. And there, it's helpful to understand that what's actually happening is someone is going into that red alert state, that fight, flight, freeze, and it's bringing on, it's a survival response. And when someone is experiencing that repeatedly, that then becomes very immobilizing. So that's, as I would see it, the main difference here. So when we're talking about very high anxiety, we're talking about a fear response that is just happening over and over and over again, which becomes immobilizing, it's exhausting, and one just can't function.
Yes. Okay. So really immobilizing, and it's extremely exhausting, actually.
It is.
Yes.
Yeah, very. Yeah.
Well. And to a point where people experience panic attacks then, with the anxiety.
Yeah.
Well, if we can just talk a bit about panic attacks. What is a panic attack?
Panic attack, well, first of all, it's very, very distressing. And so I think I'll just back up a little bit and just explain and create some context here. We've got really 2 parts. We've got the go state, that's foot on the gas, foot on the accelerator, and we have our braking state, which is rest and digest.
Okay.
And that go state, that's our sympathetic nervous system, that is there for any kind of emergency. And it's a remarkable state. That's our red alert state. We're foot on the gas, on the accelerator. And when we go into that state, it's a survival response. Immediately, there's a surge of adrenaline, which enables us to move quickly because everything speeds up, our heart rate. It means more blood to the muscles, to the brain, to the eyes. Also, all the vessels in the body, they constrict to create more pressure so that we have more blood that goes to the brain, the muscles. So and that means the heart's beating faster, respiration increase. So it's a rapid response. There's also an increase in cortisol in case there's any kind of injury, which is supposed to and does help our immune system. And it's very protective. We also need glucose. So glucose is released so our muscles can pump, can fire. And so in this red alert state, we can do remarkable things. We can run very, very quickly, jump. We've got increased strength. It gives us an ability to focus, and so that we can look at the threat very carefully. And so we're able to do incredible things in this state. But we should only be going into that state a few times a year. It's a survival response. So I think I've sort of noted before is that, if you're out in the bush and there's a rhino, you'll go into that go state. You're up the acacia tree.
You need to.
You need to. And as soon as the rhino is gone, you don't even know how you got up, let alone how to get down. That's how profound the response is. But there's a significant limitation, and that is it takes us anywhere from 20 minutes to 2 days to come out of that state. So if you wake up in the lodge the next morning, what you're going to find is you're likely still in that red alert state. So it takes a long time to come out. So we should only be going into it for really actual threat and for survival purposes. So that's our go state. But the other state is the rest and digest. That's foot on the brake, foot on the brake. And that's our healing state. And it's a remarkable state where there's a lot of healing that takes place. Rest, everything normalizes, skin color, the blood goes back to the digestion, goes back to non-vital. And it's a healing process and a resting process. Now, we can only be in the two states, one or the other. We can only be in go state or red alert, or the rest and digest, foot on the brake, rest and digest. Now, when someone experiences a panic attack, what has happened? They've gone into the go state and they have become completely overwhelmed. And in that state, we've got fight, flight, freeze, because we need to fight the threat, neutralize by fighting. We need to flee or evade. Or another way is if we just freeze and we don't want to be seen, just not noticed. That's another way. So one freezes. And in a panic attack, the experience is one of profound fear and becoming completely overwhelmed to the point that one actually can't function. And in that moment, we very often experience that we've lost complete control. Something terrible is going to happen in our body. Something's going to happen to us. We're often breathing so rapidly that we can't get enough oxygen in. We worry that we're going to suffocate. Something's going to happen. And then there's the mental side. There's thoughts of my mind's going to slip out of gear. The back half is going to fall out. I'll never have my identity again. Just a whole lot of terrifying, irrational thoughts that occur.
Fearful.
It's extreme fear. It's so fearful. Yeah. And so in that state, that is completely overwhelming. And because one goes into that state, that red alert state that's so overwhelming, then that's going to continue to recover from that. Is going to typically be hours and sometimes even days if it was very bad.
Yeah, so it actually has such a big impact, having a panic attack, and understanding what happens to your body can actually help so much.
Yes, yeah. I think that's the main thing. If one can understand what's going on, then that already helps to explain it, normalize, because someone who's experiencing a panic attack doesn't understand how come they start to get the chest pain. But as soon as they begin to understand that what's happening is they're tending to hyperventilate, and as you're hyperventilating, you're taking in more oxygen, you're not getting the CO2 out, and you're building up lactic acids, which is going to lead to some discomfort. and sometimes some cramping. Nothing actually bad can happen with a panic attack, in the sense that what you think is going to happen, you're going to collapse or something. No, all that can happen is because you're hyperventilating is at worst you just simply would just sort of pass out.
Okay.
And that's the body's way of just normalizing and correcting the breathing, because you are over breathing, you're hyperventilating, and through that everything then gets normalized. So nothing terrible or bad actually can happen. It's again the confusion and being afraid of what one thinks will happen, but just understanding that process can be a first step in just coping with it.
Just knowing what's actually going on with your body can really help.
Indeed. Yeah.
Looking further at panic attacks, so what can be done? So if you understand a bit more about the panic attacks, what else can you do if someone experiences a panic attack?
Okay, I think this is such an important question, because so many people experience anxiety, and anxiety to the point of a panic attack. And there's an enormous amount that one can do. Just the main thing is understanding. So as soon as you start understanding that your body, your system is either in go state or in rest and digest breaking, and understanding that you actually on a continuum here, and you start to look at, first of all, what's occurring around you, and start to see, when I become fearful, and recognizing what is it. Okay, it's perception of threat. What's threatening? Is that valid? Being able to look at that, and because so often we kind of want to get away from it, want to push it away, and that just drives that anxiety, that becoming more and more. So actually rather staying with it and just identifying, or trying to identify what it is, which can mean just writing on I know if you've got a little notepad, just noting what that feeling is, or what it is that's bothering you, or what you're worried about. And then you just write it down, but just identifying it, expressing it already begins to bring relief. And then later on, it's a good idea to have a worry time where you can come back. You set a time at 3:30, and for half an hour you're going to deal with your worries. And then you look at that. And it's amazing, by the time you get there, often you figured it out, but just or you still haven't, but having that time, it'll be okay, and you'll be able to look at it. So a big thing with any kind of fear is, first of all, learning to identify it earlier and earlier, because the earlier you identify it, if you identify it at this very high level, you're very overwhelmed. But if you learn to catch it earlier and earlier and earlier, then you can begin to work it through. First of all, just beginning to understanding the body, how your body responds, and understanding that it's a fear response, and learning to catch that anxiety or fear earlier and earlier and earlier already will help you, where you don't go into that extreme anxiety or a panic attack. But if you find you already have moved into that, the main thing is, if you've learned breathing, we know that breathing and any kind of deep breathing, abdominal breathing, belly breathing, that's an incredible thing to learn. Because if you learn that, and it's very easy to learn, if you're seeing a therapist, you can learn that very easily. There's also a lot on the internet about it. It's something that you can learn, and we know it can be profound. Because what breathing does is, I mentioned earlier that it takes anywhere, once you go into that red alert state, 20 minutes to 2 days for it to normally correct and go back into rest and digest, your breaking state. If you do this breathing, you can actually, it's a short circuit and it corrects it. You can actually, in anywhere from 20 seconds to 2 minutes, actually completely reverse that.
So it's so quick, actually, and so
very
much relief.
Quick. Exactly. And the more you practice relaxation, the more you become aware of tension, anxiety, stress, and then particularly where there's it's becoming immobilizing. And then being able to, as soon as you identify it, you're more aware, being able to do your breathing, which will correct that very, very quickly. So it just gets, you're able to work with that more and more, which is very, very helpful.
Okay.
So, but that's the case if you've learned breathing. So I really think it's important for everyone to learn that. And breathing is part of well-being, longevity. Look at all cultures that have studied and the art of breathing and utilizing it. All connect with longevity, all connect with wellness, well-being. So that's key. But if you haven't yet learned that, the main thing is slowing down your breathing. Once you understand a panic attack is you're hyperventilating, you're breathing too much, too quickly, and you're not getting the CO2 out. That's really what's happening in a panic attack. So having to sink down. Yeah.
Okay. So it's really focused on your breathing and helping to correct that.
Yeah, it's remarkable what breathing can do.
Okay.
The other thing that's often happening with a panic attack is that we've become very isolated. We may have people around us, but mentally, subjectively, what's actually happening is we've become preoccupied. We're absolutely terrified. And so reaching out to someone, the moment you can connect with someone, reach out, you now make that fear, you now get it out. And it's remarkable when generally when we talk about a fear, as we start talking about it, we already start to experience relief, because the main thing is starting to get it out, to express it. It's when we push it away, that we become more and more anxious, fearful. So just talking about it brings relief.
Breaking that isolation.
Very much. That is the key, because so often fear is connected with being very isolated. That we're trying to cope with a perceived threat all on our own, or what we fear is going to happen, what we think is going to happen, actually isn't that like that. And the moment you talk it through, it's now something that's shared, and immediately that anxiety, that fear starts going down, and we can start figuring it out together, or starting to look at it. And that also means, as I said earlier, that when you have to start to look at what is it that's worrying me, what am I so scared, what's the threat, as you talk it through with someone, you begin to realize, no, it started at a 10, and suddenly it starts coming down to an 8, 7. And as you talk it through, it's much lower. And if it is significant, you can start to work out a plan, ways of addressing it, and how to solve that.
We really are social beings, and we need each other.
We are. We really do need one another. We need to be in contact. We need to be engaged. And the way we wired is the way we test reality, the way we understand ourselves is all relational. So we constantly need to be in relationship, interacting. And the more that we're doing that, the more well we feel, the better we feel, the greater the relief, because we really are social.
And that's probably also why the lockdown had such a big impact, and still does, because a lot of us still work from home, and that just adds to so much of the isolation as well.
Very much. It was such an abnormal time, and it through threat and what was happening, we had to relate in ways that aren't meaningful, aren't helpful longer term, and we become disconnected very often from one another. And we need one another.
We need one another. Yes.
Yeah.
Well.
Yeah.
Okay. So if we just look at just maybe at a bit of children, children also experience a lot more anxiety than before. So just looking with parents, what is the behaviors to look out for with children specifically?
Yeah, there's been such an increase of anxiety and the anxiety that children experience, and parents seeking help for their children, or children themselves reaching out. There's been an enormous increase there. And I think for children, there's an additional challenge there.
Okay.
And that is that, and again, it depends on the age of the child, but our ability to express emotion requires language. And very often children haven't yet acquired the language tools to express how they're feeling. And that means that they then have these impacts and there's this fear. But it's very difficult for them to actually express the fear or even understand what's happening to them. And so they experience that fear or anxiety, but don't know what it is or how to even express it. So that's very, very difficult. And that's why with children especially, the main thing that we see there is just to monitor and start looking at some of those external signs. So obviously withdrawing and any change of routine or habit, anything like that. So changes in bedtime, changes in sleeping, changes in participating in school or schoolwork, changing marks, getting low or changing, not participating in sport. Any major change are some of the indicators really that one looks out for, because children very often they don't know how to express it.
They don't have the words.
They don't have the words, yeah. And they're being guided by parents. And if a parent isn't noting it or they don't register it and aren't taking the time to connect or look at, a child just is just not knowing what to do and feels very, very helpless.
Sure. Parents can really help children, just to help them to identify it and just to know what to look out for.
They can.
Yes.
Yeah.
And as soon as you know what is going on, you can really assist them.
Yeah. I think it's so important. It's, as you say, it's taking the time, parents taking the time, and being able to help them talk about it. I mean, one of the things we saw in COVID is that parents were so busy trying to manage a family and relatives, trying to cope themselves, that they often had lost sight of or overlooking where children were, and checking in with them. And many children, for instance, were hearing all the bad things happening in the news, hearing, mum or dad talking about a loss or something bad happening or a new strain in the pandemic, and without aware again that there's a child there is absorbing so much, but can't filter, can't use their judgment, and is becoming very anxious or overwhelmed. So very often children absorbed a lot both during COVID and this wasn't seen. And so children are still carrying a lot. There have been big changes in their lives. And so the key thing there is parents taking time to connect. And that just is in general the importance of connecting with children, making time. Because the moment you can start talking to a child and helping them talk, as they express it, they feel relief. And we ourselves find it difficult sometimes to even identify our emotions, let alone the cause of it. And so for children, it's even more. And as you talk to a child, they begin to have clarity over what they're feeling, that it's not this feeling, it's that feeling, and beginning to understand what it is they're distressed about.
Really talking about it and just creating some of that space, that time with them. And it doesn't seem like it has to be long. It's just taking a short time, but being really present and talking to them.
Yeah, I think that's so important. It's not so much the duration, quantity. It's more that awareness to connect and making that time. And when making that time, it's being really present, not having distractions, TVs, phones, cooking. It means really just being present, listening. And we so quickly want to normalize it or indicate or give reassurance. And there's a place for reassurance. But if we quickly normalize it or reassure, without having really taken the time and helping a child to express it and begin to understand it, then that reassuring or normalizing is premature, and a child still can't get that out. So it's taking that time to really connect and helping them understand how they feel and helping them and exploring what it is that's contributing to that. What's the cause, or what is it? And then beginning to help them with finding some strategies and looking at ways of approaching it that help them to figure it out and develop mastery and become more empowered and more confident. And where indicated, helping them to normalize and reassure them.
There's so much that parents can do as well to assist the children, and imagine it can be great relief for them, both for the parents and for the child then, to be able to do that and to work through the anxiety.
Yeah. So often, I think, as parents, and I myself as a parent, and you are, but I'll just talk for myself, one can very easily focus on what you want the best for your children, a child, and what they should do and what would be effective and helpful. And actually, a lot of the time we need to, that's all fine, having the big picture, but actually very often it's in the detail and just being present for a child, hearing them, listening, spending time, and just allowing them to express themselves. And they're smart. They're so responsive. They learn quickly.
Yes.
And very often that's all that's needed.
Well, I really go with you with that, and it's hard to actually stay with the child, and even from my own experience, to stay with them, and to be able just to sit with them and really hear them. And I think a part of it is we lived life already. We know a lot of the things, and trying to help and trying to problem solve, but sometimes doing that a bit too quick for them.
Yeah, very much.
Really learning to stay with them and help them first work through it.
Yeah, it's so important that we don't go ahead of them. We have got some ideas, of course, and we have to guide and support and assist, but not to go too far ahead. And the challenge is often just staying with the child, walking with them, without going too far ahead, where they fall then backwards on their own, and you're not there or don't see that they've fallen backwards. So it's really staying with them.
Staying with them, yes. Well, yeah, I think that this was really so meaningful. And I think there's a lot of people that really experience high anxiety, and there's been a massive increase. We as a society are really dealing with a lot, and dealing with a lot of anxiety, dealing with depression as well. And I think just starting to understand where it comes from and what is happening, and understanding from a community perspective, how come it happens? How come the anxiety so much? And in our family system as well, just what happened with us as a family, and dealing with the trauma, dealing with the loss, but also the uncertainty.
Very much. Yeah, I thought, again, you noted there's so much that's happened, and also, we didn't get a chance, but just to note, I'm so glad you mentioned it, depression, because anxiety and depression really go hand in hand.
Yeah.
And there's been such an increase in depression. And we know that the three cornerstones of depression, which is very much isolation, it's that powerlessness, and it's any anger, it's suppressed anger. Anytime that we feel very angry, we've been unable to express it, suppressed, and we feel powerless and isolated, we're likely going to experience depression. And this is exactly what has been happening through the pandemic, and that one was very isolated, one felt very powerless, and there was a lot of what was beyond our control, that locus of control, that external locus of control, where things just happened to us, Whereas when we have an internal locus and we can manage, and that's going to be very effective. But so much that happened was that external things happening to us, being out of control. And then also experiencing strong emotion, being unable to express it, and that anger. There was a lot of frustration, anger, unable to express it, or not that there was no place to. And so again, then that anger just pushing it away. And when we have that, we've got depression. So there's been an enormous increase with both anxiety and depression. And it's going to be really some time before, again, we can make sense of just quite what an impact this has all had. And there's a lot of suffering, what people are sitting with and just don't know. And are just trying to cope, trying to survive.
Really becoming aware of this, and like you say, it might be years before we really actually understand the impact of all of this, and learning to deal with it, and actually moving towards wholeness again, and reaching out and really understanding ourselves, but understanding the value of connecting and engaging with others as well.
You mentioned wholeness, and that I think it's so important, that quality and that experience of knowing oneself, but also having awareness of the other. And so in that moment, it's not just me or you, it's you and I. It's our relationship, it's our interaction, and how much that contributes to our shared well-being. So it's connecting again and wholeness, yes.
Okay, thank you so much for just for talking about anxiety, and just sharing all of your valuable inputs and your knowledge as well. I think it can be really meaningful for people to hear about this, and just to understand a bit about it, to move towards increased mental health, and just really living life again, and not being in survival mode the whole time.
Yeah, I appreciate what you're saying. And for me, I've enjoyed being able to share this with you. You're a very experienced psychotherapist and with a deep sensitivity. So to be able to talk about this together, to create awareness and to help others, because as you say, a great deal is just understanding. The more that one understands, the more that one can now understand what's going on and find ways of addressing it, overcoming isolation, connecting, understanding oneself, and becoming empowered. So for me, very meaningful and a great opportunity.
Okay, I really share that. It's really been meaningful.